OET Reading Sample 3, Text 1, Conjunctive Group Therapy. A case study of an adult type 1 diabetes mellitus patient. Question 7. Okay, this is question 7. In the first paragraph, what aspect of DM is highlighted? Now you have to type in the chat box what are the hedging words in the question stem. First line is known as the question stem. This part. This is known as question stem. Then 4 answer options. Is the hedging word keyword in the question stem?
Aspect of
Aspect of yeah. What aspect? First A option, the demanding treatment regimen entails. Treatment is the hedging word or the keyword. Second option, B, the extent of the problems. Yes. Problems, yes. It causes to society. Third one, the degree of disruption it brings to patients' lives. Yes, disruption. And fourth one, the severity of medical complications. Yeah. These are the hedging words. Did you get any idea? What do you say? Which option?
C.
Type in. C.
C, Father.
C. Okay. Why is C?
The onset of diabetes generates various biological and psychological changes, may leads to patients to force complicated changes. So there are changes in their lives, Father.
Yeah, patients' lives. Patients are the thing, and it doesn't speak anything about, they only say public health problem, but it doesn't cause in general sense, from our common sense, medical knowledge, we know, me having DM1 will not cause anything to the society, right? It's not going to be a big issue for the society. Society is not bothered, but I solve problems for me. So they don't speak about treatments, but they speak about all these difficulties, disruption in the sense, problems it brings to patients' lives. Okay? Problems it brings to patients' lives. Yeah. So it's that easy. And, you know, see, diabetes mellitus is the concept here. And the complications are responsible for high morbidity and, in many cases, premature murder. Type 1 diabetes. You see, this is common. Diabetes mellitus means it includes both type 1 and type 2. The introduction first gives a general statement. Then it comes to type 1. We are bothered about type 1. DM1 here, right? DM1. So our answer will happen only after this name. Type 1 is the name. DM1 is the name of a condition. So what are the disruptions mentioned here? Type 1 diabetes. This is how. First one is general. Normally it happens. As I've told you, they might speak about general studies, then a particular study, particular name. So disruptions here after type 1, disruptions are given. What are the disruptions? Insulin injection is a disruption, right? Difficulty for the person. Biological and psychological changes. That's a disruption. Disruption means the challenge or difficulty or inconvenience that is caused and may force patient to face complicated challenges. Complicated challenges is disruption. Such maintaining optimal health is a disruption. Not like you, those who have diabetes will have to get up early in the morning, 4 o'clock, and go for a walk, and do some exercise, but you can sleep cool. Those who have no diabetes. So these are the disruptions. And managing their condition. Managing condition takes a lot of effort. So that's also a disruption. And dealing with possible comorbidities. Comorbidities, you know what are they? And, you know, maybe they have retinal problems or they will have other complications with the heart or neuropathy, all those things, you know. Okay, unpredictable symptoms. Unpredictable symptoms, they may feel tired, exhausted, they may go unconscious, all these things. As a chronic condition, DM demands radical changes in lifestyle. Radical changes in lifestyle. All these are disruptions or difficulties or challenges in order for the patient to achieve effective adjustment. So everywhere, they never mention society. They are mentioning about patient, right?
Patients.
Patient, yeah. Patient and patients. Nothing else. And normally it will not be. So they are not speaking about any treatment. Do they? No.
No.
And the extent of problem is causes to the society, you see, not to the person, but about to the society. They don't speak any problem causing to the society, and it's not a big issue for the society. The severity of medical complication can lead to. Did they speak what severe, how severe, all those things about the medical complications?
No for that.
No.
No.
Yes. So cool, so simple, so nice. Actually, the whole paragraph, except this first part, is a general statement I told you. Until you reach that particular name, which is given in the question stem, that is DM1, which is said type 2 diabetes. In bracket, they have given DM1. Until then, you do not worry. After that, all the things are given is disruption. Everything is a disruption in patient's life. Hope that is clear. Okay, so it looks like this. See, all disruptions, early onset infertility, initiation, biological, psychological changes, maintaining optical, physical, managing condition, comorbidities, unpredictable symptoms, radical changes in lifestyle. This is how you have to understand it. You have to keep your visual like this. See, early onset, type 1 diabetes, what happens? All the challenges are given one by one. Though it looks like a paragraph, it gives type 1 diabetes, early onset, then 2 insulin injection, 3 biological and psychological changes for maintaining optimal physical health, 5 managing their condition, 6 comorbidities, 7 unpredictable symptoms, 8 radical changes in lifestyle. All these are the disruptions in patient's life. This is what we call the paragraph structure. This is how we have to write down and learn in the initial stages. Text 8, okay, question number 8, okay. Now come on, the question says the writer sees one benefit of a biopsychosocial approach.
Benefit.
What is the heading word? Benefit.
Benefit.
Yeah, benefit, yes.
Benefit.
Yes. And also writer sees is there means what writer sees, what he understands, his opinion, his perception. Writer sees. May not be the person feeling it. It is all the perception. What I see that somebody is interested in OET. I understand from something. Okay. So first option, allowing medical professionals to conduct valuable research.
Valuable research.
Valuable research. Okay. Research or valuable research, anything you can highlight. You can highlight adjective also. Then second option, focusing on the person as an individual rather than on the condition.
Focusing.
Focusing on the person.
The person.
C, addressing issues shared by many patients with persistent conditions.
Addressing issues.
Yeah, addressing issues.
Addressing issues.
Means what are the issues? We'll have to search for issues or research or for person who is focused in this paragraph. Fourth one, producing the most
Rapid improvements.
Yeah, in patients with mental health issues. Rapid improvements, exactly. You are all experts now. Okay, now we'll go to the text, okay? Now we have to see whether it is speaking about a research or focusing on the person or addressing some issues or rapid improvements. Most rapid improvements. While patients' individual differences play a significant role in the course of the condition, they will also share several common psychological reactions to DM1, such as denial and stress over the diagnosis, prognosis, and treatment of the condition, as well as depression. Now, this is a complex sentence. I have taught you in the writing subtest, simple sentence, compound sentence, and complex sentence. Here, this is a complex sentence, and there are 2 clauses. First sentence, topic sentence is a complex sentence, and there are 2 clauses. One is independent clause, another one is dependent clause. Independent clause means that part of that sentence has meaning in itself, whereas the dependent clause depends for its existence on the independent clause. See, while is the expression which says this is the dependent or independent clause. First one.
Dependent
Clause.
Dependent clause.
So dependent clause is not important. That will not be the focus. Normally the answer will not come from there. So what is independent clause?
They will also
share several common psychological reactions to DM1. Okay. So the question also says, is there any option which says,
C, father.
Yeah, she says addressing issues shared by many patients with persistent conditions. So topic sentence itself gives you an idea. Let's see what are the, so C is the answer, right? Allowing medical professionals to conduct valuable research. Do they speak any medical professional conducting a research anywhere?
No,
No,
father.
father.
No, father.
Nothing is mentioned about the medical professionals, doctors, nurses, somebody doing some research. Nothing is mentioned. Focusing on the person as an individual rather than on the condition. Here they are focusing on the therapy, right? Previous paragraph was speaking on the focusing on the condition. This one is speaking about the biopsychosocial approach of treating it. Fourth one, producing the most rapid improvements in patients with mental health issues. Are we concerned about mental health issues here? In the heading, what condition is mentioned?
Diabetes.
No, even general heading of the
DM1.
text. Diabetes, yeah.
DM1.
Type 1 diabetes. Okay, so mental health, they will never speak about how rapid improvements in mental health patients can be brought in. This is not psychiatry. This is the department of diabetes. Do you treat mental health patients in diabetes department? General knowledge. So read, understand, spend time on analyzing the question. Okay, understanding the question and understand each part of it. What are they speaking about? Which condition? About whom? Okay, that is cool. So 9, in the third paragraph, we learned that the patient called Ella joined the CGT program partly because. So what are the heading words?
Third paragraph.
Then
Ella.
CGT.
Program.
CGT program. Okay.
Because.
Now the thing is, they are asking for the reason. Why did she join or how did she join? Okay, the reason. Well, how did she join the CGT program? First option, her physician was disappointed with the response to medication. Yeah. Physician was disappointed, yes. Okay, with the response to medication. She had expressed an interest in her interest in having treatment of this kind, means CGT program, her interest. Now, when you read the text, you will have to look out for this, whether what was the response of the physicians. What was her response about this program? Was she interested or she was disinterested? Something like that. Option C, she felt the timings of the lessons were inconvenient for her. Timings. Because of the timing, she joined. Fourth one, her treatment was not addressing her personal needs. Yeah, treatment was not addressing her personal needs. Treatment was not okay. So she joined CGT program. Okay. Ella was a 30-year-old DM1 patient who participated in a 2-year conjunctive group therapy program while receiving parallel medical treatment for DMI. Okay, here CGT and medical treatment is going hand in hand. Okay, what does that topic sentence tell you? Treatment is going on, so doctor was not disappointed. Even treatment, D option, that her treatment was not addressing her personal needs. If it was not addressing her needs at all, she'd have stopped the treatment, right? But
Yes,
this is going hand in hand. Actually, if you understand this topic sentence, you can eliminate A and C, A and D. But then let's go on. Yeah. Therapy was based on the principles of CGT. So the whole thing is saying about the therapy, how it is conducted, right? But the question is,
why Ella joined?
Why Ella joined the?
Yeah, why? The reason they are asking, not what is the therapy or how is the therapy or how it is conducted. They aren't asking about the therapy, but asking the reason for Ella's joining. Ella's participation, does it mean Ella's joining?
Yes, father.
Yes.
Ella's participation in the group was based both on a referral from her endocrinologist and her personal request. What does it say? Any option?
Interest.
B.
Yeah?
B is
B, yeah. She requested personally. So option is B. So clear it is. Partly because, partly. Why partly they said?
Because they have referred her
Yeah,
endocrinologist.
referral from
referred.
her endocrinologist. Both are the reasons. Endocrinologist referred plus. So partly because 50% are interest, 50% doctor's referral. The first part says, while receiving parallel medical treatment says A and D can be, doctor was not disappointed and treatment was going on. Along with the treatment, she was having this one. And she felt the timings. They have not mentioned anything about timings, right? They said they will have each session lasted 2 hours, but they did not say the timing, 8 to 10, 10 to 12, evening, morning, nothing is mentioned. The answer is very clear. The question number 10, in the fourth paragraph, the writer says that Ella benefited from CGT by learning too. That is violated. The writer says, writer's opinion, right?
Yes.
Then
Benefited.
Yeah,
Ella.
benefited. Yeah, Ella benefited from CGT
DT.
by learning, means learned something. She benefited because by learning too. She learned to do something, right?
Yes.
So you have to find out what did she learn to do by attending CGT. What did she learn? First option, take charge of situations effectively. Option B, articulate her feelings in front of others. Option C, alter her approach to managing her condition. D, suppress her negative thoughts about diabetes. Number 1, A, take charge of situations effectively. What is the keyword?
Charge.
Charge of situations. Situations, no?
Situations.
Charge of situations. So situations is important, right?
Yeah. Feelings.
Here, yeah, feelings. Yeah,
Feelings.
articulate feelings.
Manage.
Yes.
Manage.
Approach.
Approach.
Yeah, manage her condition. Managing. Okay, then suppress her negative thoughts.
Negative thoughts.
Negative thoughts. Okay. So, any idea?
B.
B says articulate her feelings in front of others. Here it says Ella's combined with Ella's natural ability to express herself clearly. Natural ability means
Managing her condition.
even before she joined CGT, she had this quality, ability to express. Now they are asking, after joining CGT, she benefited learning something. Ella's natural ability to express herself clearly means combined with that, her natural ability, something else she learned. What was that? Option D cannot be because it's the natural ability. They are asking what she benefited from CGT. Text says Ella's natural ability to express herself clearly.
Option C, managing her conditions.
She was able to modify her actions.
Yeah, all this put her in a very strong position to focus on the issues that had previously impeded her self-care. In time, therefore, she was able to modify her actions and so start to make progress regarding
DM1
so that is the answer,
regulations.
right? Yeah, means she altered her approach to managing her condition. Is that clear? A, take charge of situations effectively. Now they are not bothered about situation; they are about condition, right? A condition. You get it?
Yes.
Suppress her negative thoughts about diabetes. Does the text mention anywhere? Negative thoughts is not mentioned. So, in short, this question means in fourth paragraph, the writer says that Ella benefited from CGT by learning to means what did she learn from CGT? She learned how to alter her approach to managing her condition. The phrase all this in the fourth paragraph refers to changes in Ella's own personality, Ella's behavior in the group, Ella's acceptance of her diabetes, Ella's belief in the aims of the program. Now, all this is here.
Ella's acceptance of her diabetes.
Ella's acceptance of her
Diabetes.
Yeah, even from all the previous reading, it is understood.
Clear
Now,
for
all this means whatever said above, Ella combined with Ella's natural ability. Cool. Lexical questions are very heavy, very easy. See, all this means what? Ella's participation in the group. 1, actively involved by initiating group. 2, discussions and interactions, etc. All those things are mentioned. Then they are saying all these 5. Above all this plus her natural ability to communicate effectively. Conclusion, therefore, she was able to modify her actions and so start to make progress regarding DMI regulation. The paragraph structure just highlighted. 12. In the fifth paragraph, what does the writer say about Ella's attitude before she started? What are the
Ella's
heading
attitude.
words?
Writer
Ella's-
says. Writer
Okay.
says.
Writer says means
Says.
opinion. Writer's opinion about Ella's attitude, right?
Ella's attitude.
Before she started CGT. What was her attitude before? Until now, we were explaining what happened after. Okay, what changes were brought in, all those things we explained. Her approach was changed, everything was explained. Now they are asking, what was her attitude before she joined CGT program? Option A, she felt she had been repeatedly let down by family and friends. Before she joined the program, what was her feeling? B, she was worried that she was developing psychological problems.
Developing
Psychological problems. C, she was upset by the prospect of being unable to have any children. Oh.
Unable to have any children.
Unable to have children was her problem before joining CGT. How funny it is. D, she blamed others for her inability to look after herself on a daily basis. Blamed others for her inability. We have to find out, does the paragraph speak about family and friends treated her very badly? Or does this paragraph speak about she developing some psychological problems, being mentally sick? Does the paragraph speak about she cried because she could not have children? Fourth one is, we have to find out whether she blamed others for her problems. Please read the text. She had also given up the choice of creating a family. Means she never thought of, she had given up the thought of marrying at all and having a family. So can she be worried about having no children, unable to have any children without marrying? Will you be able to worry yourself having no children?
No, father.
No.
Okay, so that is absurd. Third option, you can simply. She thought I'll not marry because we don't know what will happen because of this diabetes type 1. Anytime any complication can happen. So I'm not going to register in the matrimonial. I'm not going to marry. So she can never be thinking of unable to have any children. Any other option? Do you think what is right? Usually when there is some expression called moreover, the answer will be somewhere there. Moreover, she perceived diabetes as an external factor. Means what?
Blame others.
Blame.
From outside,
Blame
somebody is
others.
causing this. That also says blaming others, right? External factor, not my problem, others' problem. That affected herself and the family by compromising her self-dreams and potential in gender. In terms of emotional state, see Ella's attitude, emotional state, Ella's core feelings were a continuous and generalized stress and anxiety that developed from a constant sense of threat. Threat is external or internal?
External.
External. Ella had great difficulty in achieving a pattern of stable self-care and tended to attribute this inconsistency to external factors. Tended to attribute means she could not do her self-care activities and she blamed external factors. Attribute to external factors means your problems you are attributing to some others, means blaming others for your problems. Is that clear?
Yes,
Such as the physician is responsible for that, doctor is not okay, that's why I am not getting healed, or the treatment process is not okay, that tablet is not okay, that's why I'm getting feeling exhausted. All those accusations. So blaming, right? Blaming the physician, blaming the regimen, external factors. Is that clear?
Father, and also Ella expectations of the CGT, the 2 lines not indicating answer, Father. Starting topic sentence.
Ella's expectations, always there is a clue in topic sentence. Ella's expectations of CGT treatment had been very low as she thought that the group's function would merely be to soothe everyday distress caused by her condition. Means there also the taste of the whole thing is there, just to soothe that. Maybe with this CGT, maybe a little bit of soothing will be there, but that is not the final solution. She had a very low expectation about CGT. That also says she was not convinced.
Thank you, Father.
Okay. Moreover adds to it, makes it clear. The expression moreover. Is that okay? The inability to look after herself on daily basis means stable pattern of stable healthcare, right?
Yes, Father.
This one, inability to look after herself on a daily basis. In the final paragraph, we have reached the final paragraph. The writer says that Ella ultimately benefited from CGT by the keyword, hedging word.
Writer says.
Writer says, writer's opinion.
Ultimate
Then-
benefit.
Yeah, Ella's ultimate benefit from CGT by doing something. Option A, coming to accept that she could live with her condition.
Accept.
Accept. Okay, accept. Option B, gaining insights into other behaviors typical to her condition.
Insights.
Focus.
Focus on treatment.
Where.
Aware of the way.
Other thing like you can also see condition, concept-based hedging word.
Behavior.
Then
Treatment.
fact.
Fact.
Instead, please read the text.
Father A.
A, Father, coming to accept that she could live with her
Father.
condition.
There is answer in the passage.
Last.
Last
line.
finally.
Overall.
These are known as conclusion-based questions. Ultimately, what should be the overall conclusion says? Means from all the above, overall, CGT helps Ella to redefine the role of diabetes in her life, achieve reconciliation with it, and so finally to integrate it into her everyday existence. Means coming to accept that she could live with her condition. Clear? Now you say
Yes.
gradually as the intervention progressed. This is the topic sentence. If you remember when I taught you the paragraph structure, this is there for every paragraph, but we are highlighting one. See, gradually as the intervention progressed still further, numerous changes were observed. What is the controlling idea in the topic sentence here?
Numerous changes.
Yeah,
Changes.
numerous changes is the controlling idea, which means the whole paragraph will speak what were the changes. I'll show you how it can be, what are the changes, how beautifully the whole paragraph explains. Okay, now you see, gradually as the intervention progressed still further, numerous changes were observed. Change number 1. In this paragraph, it is given, I am putting it in number. Group had taught her new behaviors regarding her condition. 2. Group helped her address critical questions related to her condition. 3. She gained a clear picture of her dysfunctional behaviors. Change number 4. The previous generalized sense of worry was eliminated. 5. She engaged in stress management. 6. She gradually recognized her obligations concerning self-care. 7. She could have control over self-care. 8. She managed to stabilize her behavior as regards self-care. 9. She regained contact with lost friends and engaged in new relationships. 10. She began traveling again. 11. She continued her studies, which boosted her sense of self-worth. See, that controlling idea is explained. Nothing else is given in this paragraph. At the end, conclusion said, overall, CGT helped Ella to redefine the role of diabetes in her life, achieve reconciliation with it, and so finally to integrate it into her everyday existence. The question stem, answer option A, as well as this conclusion overall, these 2 lines have to be written in your notebook. Practice it that way. Actually, the question stem and the answer option A is the paraphrasing of these 2 lines given here at the end of the paragraph. Now I am showing the structure of the paragraph. This is how you have to sort out in the initial stages of your practice. Take time, don't worry. Maybe one paragraph, one text, you can take 3 days, no issues. Understand the structure. Then you will understand any type of paragraph, you will get this analysis. Okay, text 14. What does the word that in the final paragraph refer to? Immediately you have to go to the word, right?
Yes, Father.
You have to go to the highlighted words. Then where will you find the answer? Before or after? Where you have to see first? Before that, right?
Before, Father.
First, you have to look to before. If you don't find, you can go after. So, she gradually recognized her obligations concerning self-care and the amount of control she could have over that means self-care, right? She gradually recognized her obligations concerning self-care and the amount of control she could have over her self-care obligations. So, what are the options? Ella's obligations to the group. Second one, the stability of Ella's behavior. Third one, a recognition that Ella was vulnerable. Fourth one, Ella's ability to manage her own condition.
B, Father. ability to
Manage
own
own
It is there, no?
Ability.
It is here. Just before that word, it is there. What is that? She gradually recognized her obligations concerning self-care and the amount of control she could have over that self-care activities. Ella's ability to manage her own condition. The amount of control means manage. Do you get it?
Yes, Father.
So that means Ella's ability to manage her own condition, her own self-care. Clear, no? So just before the highlighted word, you can find the answer. If not, go after. Empowering attitude. Whoever is selfish, normally we have seen they struggle a lot to crack OET. But empowering, helping others, being in the platform, active, supporting everybody, they really crack because definitely they learn a lot as well as God will bless them as. And I want to tell you, EduSkills YouTube channel has such resources, but the full explanation, you have all the 4 modules, all the strategies explained in different videos. Definitely you can access them. They are all free. If need be, I will give all the links together in a single form. I have taught almost everything over there. Those are not just videos. They are the previous sessions uploaded. Like we have contrast word-based questions. You have gist-based questions. You have topic sentence-based questions. You have detail-based questions, which is in the supporting sentence. Opinion questions. All those are the different types of questions. There are different criteria. Those things also I have explained in my channel. And there are typical types and only such types will be asked.
Thank you, sir.
If you find my smile attractive, we'll meet again.
Thank you, Father.
Yes.
Thank you, Father.
Thank you, Father.
Thank you so much, Father.
Thank you,
Yeah.
Father.
God bless you all.
It was very interesting and very, very, very informative session. And thank you so much for taking some time out of your busy schedule. Thank you so much. God
You're
bless
most welcome. Most welcome. Yes, God bless.